Moving around your room and your home can be more difficult while you're recovering from a hip fracture or hip surgery. You may need help from others. Your physical therapist will help you learn to safely move to and from your bed, toilet, bathtub, and car. To get into bed. From standing, back up to the bed until you feel it with the backs of your legs. While holding on to the walker, move your affected leg forward in front of you as you reach for the bed and lower your body slowly to a sitting position. Once sitting, use your arms to scoot back on the bed as far as possible. If you're using a leg lifter, place the loop around the ball of your foot and gradually lift your affected leg up on the bed. Scoot up toward the head of the bed, walking your legs toward the middle of the bed, and lie back gradually. To get out of bed. If you're using a leg lifter, gradually walk your legs to the edge of the bed, then raise your upper body to a sitting position. Keep moving your legs until they're off the bed and your feet can touch the floor. Once sitting upright, take a moment to regain your balance before standing with the walker. Tub transfers. You may need a shower chair or tub transfer bench to safely get into and out of the bathtub after a hip fracture or hip surgery. If you're using a tub transfer bench, walk to the bathtub using your walker. Back up to the bench until you feel the bench on the back of your legs. Sit down. Swing your legs into the tub while you're sitting. Be mindful of how you move your legs if you have hip precautions. It is always good to have someone to help you with the transfer. To get out of the bathtub, swing your legs out of the tub. Be mindful of how you move your legs if you have hip precautions. Once your legs are outside the tub, you can stand up when you're steady. Toilet transfers. Your home toilet may be too low to safely sit while your hip is recovering. You may find it easier to use a toilet riser on the toilet or to place a bedside commode over the toilet. Back up to the toilet seat using your walker until both legs touch the toilet seat. Place your affected leg slightly in front of you. Reach back for the armrests and slowly lower yourself to sitting. To stand up, place your affected leg in front of you and use your arms to push yourself up to standing. Once standing, reach for your walker and steady yourself before walking. Car transfers. We recommend you ride in the front seat of the car on the passenger side. Make sure your driver moves your passenger seat as far back as possible and slightly reclined a little to give yourself as much room as possible to get into the car. Stand with your back to the car and back up until your legs touch the car frame and you can reach back for the seat, holding your affected leg a little forward as you sit down. Sit on the edge of the seat and slide yourself back. Then lift your legs into the car. You may need someone to help you with this. Adjust the back of your seat until you're comfortable. To get out of the car, be sure your seat is back as far as possible and slightly reclined to make it easier to swing your legs out of the car. Slowly lift each leg out of the car and place your feet on the ground. You may need someone to help you with this. Scoot to the edge of the car seat. Have someone place the walker in front of you. Push yourself up to a standing position by placing your hands on the car seat or frame of the car and the dashboard. Do not pull up to a standing position using the car door or walker. Place your affected leg forward and stand up on your unaffected leg. When you're balanced and feel steady on your feet, place your hands on the walker.